Here is what you should know if you think you want to have children after prostate cancer treatment. The risk of fertility loss after prostate cancer surgery is almost 100%. And that's because once the prostate is removed, as the ability, the connections for the sperm to get out to the outside world is eliminated. And usually when we're talking prostate surgery, that's usually means removal. As mentioned previously, the other options such as cryotherapy can be considered a surgery, but that is more where the prostate tissue has been frozen, and as a result of that, that will cause scar tissue to develop within those ducts where the sperm will be entering into the prostate, and therefore that would also effectively make someone basically infertile. As with any type of procedures that would involve the prostate, and if the patient is interested in having children later on, I would always recommend that they would consider doing some form of sperm banking that can be done. In most cases, those methods are fairly inexpensive and very effective. In some instances, in last case resort, if someone didn't think about doing that, one can do a more exotic procedure where we can actually go in and isolate the sperm from the testicles, and that would be, of course, a little bit more extensive, a little bit more detailed, and have higher costs associated with that.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.